An assistant professor in the Department of Food and Human Nutritional Sciences and a CIHR early career investigator. She completed her PhD in the Department of Community Health Sciences at the University of Manitoba in 2015, earning the Governor General's Gold Medal. Dr. Riediger is a settler who has had the privilege of learning from many Indigenous people through a number of projects and work over many years. And today she'll share with us some of her experiences in engagement. Go right ahead.
Thank you. I'd first like to acknowledge that we are, of course, on Treaty 1 territory and the homeland of the Métis Nation. In keeping with the requirements of this presentation, here are my conflicts of interest for all the funding places I've received funding. And in order to be incredibly transparent, I don't want to be misleading in any way. Some of you may know that my family had a grocery store up until 7 years ago. So I received a lot of food swag. A lot of food swag. I was basically a walking Coca-Cola advertisement as a child. I had t-shirts, backpacks, beach towel, orange crush tube. Perhaps it's maybe the renegade researcher I am today, or maybe not. I don't know. I'll let you decide. But I just wanted to let you know that's my conflict of interest. Okay. I like this quote. I use it in teaching, and I think it applies to research as well. Remember that, 1, where you stand will determine what you will see. 2, whom you stand with will determine what you hear. And 3, what you see and hear will determine what you say and how you act. And this is very much connected to empathy. And specific to research, all 3 of these points influence the research questions that we seek answer, how we go about seeking those answers, and the interpretations we make. And I think this provides an important foundation for engagement. So there are 3 areas or topics I want to talk about today as it applies to one project that I'm working on. The first is the power of social position in research and the social position of the researcher, as well as their own lived experiences. So I'll talk a bit about me. Second, my approach to engagement, or what I'm calling multi-tiered engagement. And then lastly, I'm going to talk about resistance to engagement that I faced and some examples of things not to do. But before I can talk about those 3 things, I just want to give a brief background of topic areas so you have that information. Although I'm not going to be talking about any research results today, just engagement. Okay. So some of you may know that a sugar-sweetened beverage tax is a pretty hot topic these days globally. In 2015, the World Health Organization formally put out its endorsement, which along with many other national and other countries having endorsed it, or organizations, also a number of countries have also implemented it. A sugar-sweetened beverage tax is positioned as an obesity reduction strategy. So in addition to being associated with cardiometabolic outcomes, it's important to know that obesity is also associated with pronounced social stigma. People of higher weight are less likely to get hired, less likely to get promoted. There's been numerous research studies documenting discrimination in healthcare. And as a woman, you're less likely to get married. And these are just some examples. Diabetes is also associated with obesity, and we commonly use this term diabetes to describe how those 2 conditions are married together. And importantly, stigma is also associated with diabetes. And I recently read a paper from the UK that lifestyle stigma associated with diabetes is actually on par, if not worse, as HIV or HIV. And in public health, we very much understand that stigma is a barrier to treatment, prevention, behavior change, as well as a human rights issue in a disease like HIV, whereas in diabetes, and especially in nutrition, we readily embrace stigma. It's considered acceptable. It's pretty much our MO. So that's one component I want you to think about, and which is part of my project. Another important point is that specific to sugary drinks, we know that low socioeconomic populations, as well as people who are food insecure, are higher consumers and more frequent. Canada hasn't implemented this policy to date, but there are ongoing discussions in terms of its effectiveness as well as its place in policy in Canada. Okay, so I'm going to turn now to the power of social positioning research, and I'm going to talk a little bit about my lived experience, because ultimately what engagement is about listening to other people's stories and experiences. When you're doing patient engagement or public engagement or community engagement, you're not engaging with people who are researchers. And so if you're the researcher, your job is to come up with questions or translate things into questions, right? That's our expertise. So it's about using stories and experiences for that. I'm not going to share any experiences from my partners or people I've engaged with, because I don't think that's fair. And also, in the spirit of, we ask people to be vulnerable, I will also be vulnerable. So I'm going to talk about my lived experience with food insecurity. I have personally never experienced food insecurity, but it's very much been a part of my life. So as I already mentioned, my family owned a grocery store. The grocery store was located up until 2012 not too far from here, by Slaw Red Chuck Bridge. So I never did any surveys, but I'm confident that there was a lot of food insecurity in the area. I witnessed it, and I'm just going to tell you a couple stories related to food insecurity. The first being the first time that I saw somebody steal. He was an Indigenous man, probably in his 40s, and I saw him steal a box of macaroni and cheese. It was 35 cents or 39, I can't remember. It was a really long time ago. And my dad quietly approached him, and I didn't hear what they said. The man gave him the box of macaroni and cheese back, and then I saw my dad give the box back to this man, and he quietly walked out. And he looked, I didn't hear anything that was said. He looked deeply ashamed, deeply embarrassed. And I remember that story because my dad gave it back, because that's the one time I ever saw him ever give back to somebody who stole something. And unfortunately, there are a lot of instances where we saw people steal. And I can categorize people's reactions into probably two different camps. One is the one I just described, which is shame and embarrassment. And the other one was anger. I've been yelled at for having stolen somebody's land. I didn't catch someone stealing. There's also been a lot of violence and extreme violence. And so it's very traumatic. We've had people take out knives. There were instances with guns. And when I was 18, I was assaulted at work. In addition to being a traumatic experience for me, the person who did it also was sentenced to 2 years in prison. So it's to give you a sense of food insecurity in the city and also its impact on people. Even though I'm in nutrition, it is to some extent a nutritional issue. Food insecurity to me is very much an issue about someone's dignity, and it's a life or death issue. And so I'm going to share one more story. That's not my story to share, but it impacted me. And I think about it all the time. And it also happened not too far from here at a different store, OK Groceries, which is near Logan. And a 29-year-old mother of 3 from Garden Hill First Nation was in the city for medical care. And she stole a can of Click, which is about $1. And she died as a result of being caught stealing, and she was assaulted. So my lived experience and my perspective of when public health says, let's raise the price of a food disproportionately consumed by people who cannot afford to eat, I question that. So that's where I'm coming from in this project. Okay, so now I'm going to turn to engagement. And I'm going to talk about what am I engaging about, who am I engaging with, and how do I engage? Okay, so the first point I want to talk about in terms of engagement, and this is more from not engagement specific to this project, but it's around what is the problem. I think I could do a whole presentation on just what is the problem, because there's not a lot of agreement in terms of what is the problem, what are the health issues that people are facing. And public health perspectives, and I use public health very generally, but in terms of this policy, is that obesity is an urgent epidemic. And this is controversial for reasons that I talked about already, which is stigma, but also limited evidence in terms of what its effects are on health. The second point I'd like to make is about sugary drinks as a cause of obesity. So public health very much works from a paradigm with food as nutrition. Food is just a conglomerate of nutrients. And this is directly opposed to Indigenous perspectives, where food is viewed more holistically in terms of not just its physical properties, but also mental, spiritual, emotional. Public health perspectives also are very much focused on food industry. And that the reason this policy is required is pop is cheap. Ergo, if we increase the price, people will stop drinking it, health will improve. In all my work with Indigenous people, especially over the last number of years, it's been reiterated to me and probably many of you, colonialism is the root cause of the problem, as well as racism and, of course, its intersections with sexism. And so different groups are viewing problems differently. And so it's important to have these different perspectives on what the problem is. So who? So when I became interested in this policy, it took me a while actually before I decided to do any research on it. I wrote an op-ed, thanks Carolyn for helping me with that. And actually there was an email that I received from somebody about it that kind of spurred me to research it more. And I was speaking with the executive director, Jeff LaPlante at National Aboriginal Diabetes Association, because I was already partnered with Nata and him on a different project. And I said, what do you think about this tax? Because at that point, things were kind of already heating up, and Nata had been approached for their support of this tax by a coalition of other health organizations. And he talked about, we've got issues of clean water. This isn't really, he didn't feel really that good about it. And I said, would you be interested in studying it? Like, if you're not really sure if you feel like this is a good idea or not. And so he said, sure. And so as we talked about how the project might look like and thinking about, because it's about taxation, having partnerships both on and off reserve, and so he suggested to reach out to 4 Arrows, so that's how that partnership developed, and that's the partnership formed. And then I've already been acquainted somewhat with Michael Champagne from Aboriginal Youth Opportunities, so I reached out to them, and they were also interested. So those are the 3 primary partners on the project. And then I'm going to talk, and then I would say that my team and trainees are also a very important part of the project. And I think we don't utilize other people on teams as much as we should. And so I put team and trainees down because especially when we're thinking about working with Indigenous people. I've been approached by a number of academics, how do we engage with Indigenous people? And it's kind of always thought of as Indigenous people are out there somewhere. And I'm like, well, Indigenous people, like non-Indigenous people, are really everywhere. There are students, there are colleagues, and we have a lot to learn from them too. And so I put my team in training down. And then the third point is history, and I'll get back to that. Okay, so my approach to engaging with my partners is I always go back to my values, and I think about how my approach communicates my values. And so one of the things that I normally do is I meet partners where they're at. In academia, we have a hierarchy, so I always go meet my department head in his office, for example. If you go see the associate dean or a dean, you go see them there. And students come to you. And so if we always assume our partners or patients or whoever you're engaging with are going to come to you, that communicates something. And so most of the time when I go meet them where they're at. The other thing I do is that I have way more small meetings than I have large meetings. Although I think it's important to have advisory groups and those types of things. I find it's much easier for me to build relationships in small meetings, one-on-one or one-on-two. And also, it's easier to share information that way. So it shouldn't always be about time. What's most efficient? You need to balance that. The other point I wanted to make about my approach, and this kind of connects to meet partners where they're at, is that I try to always meet at Indigenous-owned places. Because research is not just about outcomes, it's about process. So before NEGCON is closed, I would always meet AO at NEGCON. Lately, we've gone to feast. And so I think it's important because it makes people feel comfortable to meet someone where they're comfortable, and also to support the community more broadly. Okay, I'm not going to talk too much about budget because I think, Carolyn, you just did a talk about this, right? I didn't see it, but I have a feeling I'm going to be reiterating some of your points, which is the first one, to compensate for time and expertise. So where possible in your grant, always compensate for time and expertise of your partners. The second point is to be responsive to your partner's needs. Don't assume, what people need to be involved in the research. So ask, and also I find a lot of my partners are on, especially AO is on Facebook, so I get to know what they need or what's going on through social media. So that's one thing that I've incorporated. The third point is opportunities for partner-identified training and learning, but also KT. How and where do my partners want to learn and share knowledge? To have the budget for that. And the fourth piece is around scholarship and stipends for Indigenous students. And I've prioritized in both my projects, my CIHR projects, to have an Indigenous student with me for the summer. Because in my previous position, it was very clear to me that the undergraduate level is a bottleneck in terms of training more Indigenous graduate students and scholarships. And I think that a lot of academics, unfortunately, don't like to get involved as much in undergraduate mentorship. And I think it's really important. So that's something that I do. And which has been a really great experience for me as well. Okay. So another aspect of engagement, or what I think is pretty much the only engagement I do, I don't consider working with partners engagement. It feels they're my partners. But in terms of my broader community engagement, and what I ended up using the CHI engagement funding for, was to start this series called Food is Medicine with Aboriginal Youth Opportunities as well as NATA. So some of you might know that AO has a regular Meet Me at the Bell Tower event every Friday at 6 p.m. So this is existing, and we were basically piggybacking on that and all the excellent relationships that exist existed in the community. So for those of you that have never been, so you start outside at Bell Tower, that's the Bell Tower, and then you move inside after you are outside bit to the Indigenous Family Center, which is right across the street. And it's inclusive of all ages and abilities. There's no stairs in the Indigenous Family Center. There's a bus stop right in front. The Bear Clan is right next door. Every single time I've gone, there's a group there. So it's and the ones that I've always done have been very well attended. Probably between 60 and 80 people. AO does all the advertising, so I really do not much at all. I don't really take credit for much of this. And then we always have food. So the first one we did was food is medicine, and in that one we just talked about, or we invited community members to share what their ideas and priorities were, and it was really open. Notably, nobody talked about increasing the price of food as a way to help people become healthier. Actually, in none of my work, in the thousands of people I've talked to, not one person mentioned that. It's very much an academic idea. So not all of the, so we've done 4. Food is medicine, food is love, food is resistance, and food is sharing. One was specific to this project, which was food is sharing, where we talked to people about where they shop so that we could go to those specific stores to document what are the prices of. So the last, the who, it's not really a person, but I talk about engaging with history. I think this is really important in Indigenous health research, but also all research. We don't really consider it. And it's aligned with Indigenous approaches or ways of knowing. I relate it to the 7 generations teaching, so the importance of looking back as well as looking forward. But if we don't consider history, and you're not taking into account, the inertia that history provides, you're usually missing something, and we do that in public health a lot. We miss it in one point in time. So I think it's important. And for this project, it's important for 2 reasons. One, because it shapes current health inequities for Indigenous people. And the first picture is a picture of a residential school. And some of you may know that there's been some work that has directly linked hunger during residential schools to the current inequities in diabetes. And so history has very much shaped the current health status of Indigenous people. What came to me a little bit later was how important history is also for shaping food systems, and specifically sugar. It actually came to me while I was on holidays in Jamaica, and I was reflecting on the history of Jamaica, and it came to me, sugar and slavery. So this is a picture of sugar cane. Sugar really is what it is today in our diets because of slavery and oppression, and that has shaped different agricultural commodities, because we don't actually use sugar cane in our sugar-sweetened beverages anymore. We use high fructose corn syrup. That's not an accident. We no longer really support imports of sugarcane from countries like Jamaica. I should say we don't, but there's a lot of policies in place that have steered us towards high fructose corn syrup. And there are, certain groups that have benefited and not benefited from that. And so I think this is really important when we're thinking about policies about sugar, because there's that. And then I just saw this not too long ago about sugar beets, and Indigenous people in Manitoba were exploited on beet farms so that settlers could enjoy sugar. Kind of just to sum up my engagement, piece here. Engagement really is the foundation, not just for this project, but it transcends kind of everything that I do. So the first part is ideas, criticism, networks, and knowledge. I benefited tremendously from the networks of my partners. I'm just going to give 2 examples of ideas and that came from my partners that went in the grant that were one is about language. So Byron Beardy told me, we don't have an OG3 word for tax. So, and it's like me, talking to elders and how does this fit in with our knowledge? And so that's something I'm going to explore. And the other piece was from Michael Champagne, and I'm not going to talk about his framework because that's his to share, but his suggestion was to talk to business owners because in order to address health inequalities and strengthen communities, he believes jobs are really important. And so that's a group we need to talk to. And interestingly, I'm going to see a lot of pushback from reviewers for that suggestion, but I'm looking forward to that part of the study. And of course, engagement is going to be a really big part of recruitment. And I know that data interpretation already, since things are going on now, is going to be really important. So for those of you who do some Indigenous health research, you will know that this is the norm in Indigenous health research. So I wrote legitimate research because I wouldn't be able to do this without my partners. I wouldn't have any credibility if I didn't have good relationships with my partners. So there's that. And then the last part is about relationship building. And I put down my university team and community team. And as I mentioned, because this transcends my full research program, I have other students and other projects that are doing other things. But when we do a bell tower, everybody helps prepare food. And it's been really great, I think, for everybody on the team because it's another opportunity to get to know each other, to spend time together. That's not just it's work, but it's not work. And unfortunately, I realized I didn't have any pictures of us cooking, but I have some pictures of my team. And so I think that in general, it's helped everybody on the team, regardless of the project, in terms of building trust and also promoting an inclusive environment for all the students and everybody on the team. And it's also been about building relationships with the community and those students who aren't involved in the project. In the last bell tower, I had 6 or 7 students from my class also attend. So I've tried to integrate it to some degree in teaching because I think that relationship building is really what it's all about. So I'm really excited that one of my students is actually going to be joining Michael Champagne on a trip to Belize for community service learning, which ended up, it was one of the food is resistance bell tower was about that. So anyway, engagement is great. Except when it's not. So I'm going to turn now to resistance to engagement. What I've come to realize as a junior faculty member is not everybody's acquainted with engagement. And because it's not the norm, working in a different way, especially one that challenges the status quo, requires courage and being uncomfortable. So I've learned a lot from a recent experience in trying to facilitate engagement, being a larger organization and Indigenous organizations. And I think there's a lot to learn from failure. So I'm going to just identify some problematic behaviors for people who are trying to get involved in engagement of any kind, it's not specific to engaging with Indigenous people. So the first one is tokenism. This is very, very common. And it's very, very hurtful. So tokenism is having engaging somebody on a team just for the purpose of basically checking a box, but not listening to anything that they have to say or including their voice. So in this regard, with this project, I was actually told, I think I can find an Indigenous person to ask. So it's not about cherry picking people who agree with you. That's not engagement. That's assimilation. We don't do that anymore. Or hopefully we don't. So the second point is I call bringing out the evidence hierarchy. Engagement with people with lived experience means that you value that lived experience as real knowledge. So to come back and say somebody's experience is not valid or at the same level of knowledge as academic knowledge really runs counter to ethical, authentic engagement. If you believe that academic evidence is all we need, go to engagement. Okay, third point, speaking for others. In this case, if you're non-Indigenous, you don't speak for Indigenous people. I don't speak for Indigenous. Okay, that's pretty simple. There really is nothing else to say about it. Fourth point, unsafe environments, and specifically judgment. There's no room for judgment in ethical engagement. It is incompatible. I don't really know how else to say it. It makes it, it shuts down any opportunity for somebody to feel safe, say something, which is the whole point of engagement. Another important point is realizing the difference between being held accountable and being attacked. Oftentimes, accountability can feel like you're being attacked when you're not ready to be held responsible or accountable for your behavior. So it's important to recognize when people might say something, that point out if you did something that's hurtful, it's not an attack on that person. It's about behaviors. And so a real barrier is when people get defensive. Either they're angry or sad. You don't tend to get anywhere. And finally, if you are called out and held accountable and you make an apology, it's very important that you follow through with change behavior. Because if you apologize, keep doing it, that really isn't an apology. And so it's impossible to have any engagement with these behaviors. Okay, so just to sum up, some of my lessons learned thus far in engagement. First, examine your own social position and lived experience on an ongoing basis. Sometimes called reflexivity. Importantly, your social position doesn't prevent you from doing engaged work. It just means you have to be reflexive of it. Sometimes you don't know what you don't know. And this is just as true for quantitative research. I forgot to make that point because sometimes we think quantitative research. I mostly do quantitative research. And actually, there's somebody else in Canada who's doing sugar-sweetened beverage research as well as me. And we have the same research questions for very different reasons, which is very interesting to me. But it just goes to show you how, I think, important where you're coming from influences why you ask questions and what you're doing. The second point is about embracing intellectual humility. So this is about being open-minded. Again, you don't know what you don't know, and you don't know everything. So be open to other knowledge. 3, as I've already mentioned, look at your whole team. There's a lot of opportunity to integrate trainees with other other individuals on your team and to include those perspectives as well. Fourth point, trust. So in Indigenous health research, there's quite a bit of literature on how communities don't trust researchers, which I understand, but not as much as talked about researchers being trustworthy. So it's really important when you're doing engaged work to be trustworthy. Be clear about your values and then have your actions align with those values. And the second point about trust that a lot of people don't talk about is trust in the people you're engaging with. Trust the lived experience of somebody else. And the fifth point, don't be a fair weather ally. Walk the talk. New paradigms in integrating different viewpoints will require trust, but also courage, difficult conversations, and a lot of critique. So I received a lot of critique from this work and it barely started. I've been told my research is dangerous, biased, divisive, trivializing the health effects of sugar-sweetened beverages by talking to people about their feelings about drinking sugar-sweetened beverages and not using real evidence. So it's been an interesting learning experience. I'd like to gratefully acknowledge my partners, Jeff LaFont at NADA, or National Aboriginal Diabetes Association, Michael Champagne, and many others with Aboriginal Youth Opportunities, and Byron, Larry, and Raquel at Four Arrows. My collaborators, especially Dr. Andrea Bombach at University of New Brunswick, and Monica Sear and Myra Tate, who are both up-and-coming Indigenous scholars. Monica Sear, who's in nutrition, and Myra Tate is a First Nations lawyer whose expertise is in tax law. And my many trainees who have not just worked on this project, but on broader projects on sugar-sweetened beverages. So thank you to all of you for listening, and I welcome any questions.
So go ahead. Anybody in the room who has any questions? We also might have some from online. Go ahead.
Hi, I'm Thomas Waldron. Thank you for the presentation. One of the things you talk about sugar, about feelings as an Indigenous person, as part of our whole holistic way of we look at things, spiritual, mental, physical, emotional is part of the whole way you need to look at the research, what you're doing, which is very good. But when you look at that sugar thing, there's been research done saying that sugar is very addictive. And so when you have people who are pushing back against that, you got to look at the addiction side of people. So when you talk about it, I remember working with Dr. John Gerard back in the mid-1900s, trying to get prices for milk to be the same, regulated the same way alcohol is regulated through the province. And it's still being pushed back. So we're looking at almost 30 years of it being pushed back from governments in regards to policy development. And so I think it's very false for other people to say, well, no, look at this one. You can go up north and buy a bottle of pop, 2 liters or $1 and a 1 liter of milk for $30. So what do you think the parents going to buy to make a child happy? My other, I guess the question I'm coming to is, have you looked at our traditional sweeteners? Such as, right, in regards to like maple sugars that we've created. We had our own ways of sweetening our foods at one time, which are very non-addictive. And how we never benefited economically from that. So that has to be looked at also in regards to the economic and social applications when we're doing this type of research with Indigenous people. It's nice to have a captured market within the urban setting, going to it, but that's not really going, you have to go to Garden Hill. Because at one time, traditionally, they were our gardeners. That's why it's called Garden Hill. they are the ones who supply us with healthy foods and trade it with us and drive things down. So it was an economic base activity for them. And the other thing is, how do you look at our traditional food, the use and sale of our own food to our own people within the city? Because we're restricted. We're saying, well, we can't deal with our own food. We have to buy this. And then looking at, or is there some way to test our food for the health benefits, such as when they say, well, when we ship chicken up north, those are what you need to train to become an athlete, is to eat chicken because of the byproduct. Well, we have deer, we have rabbit, or have less fat than that chicken. Why are we being told we have to use chicken when we don't test our own foods for sale, right? And how do we deal with that? Bartering is one legal system. While we used to barter at one time, why can't we still barter when we try to supply our own foods within the city? We're very restricted due to legislation and policies. So I think those would be some things to look at as part of maybe the future. And like I said, the resistance to engagement isn't really the way we try to stop things. It isn't what we're trying to do with resistance. We want to make sure you're trustworthy first. And I like what you said in one of your slides there. Is see and be seen. Get out of your office, walk around more, and make yourself visible and accessible. And that's hard for researchers to do, I believe, because they're within their comfort zone of being within their own little classroom and read from a book. Well, the people know me are part of some tribe. It's time to be comfortable being uncomfortable with the difficult sessions that you're on. And it's all right to be, and we're going to be uncomfortable by you coming to us. So you have to build a relationship. That takes time. Unfortunately, when you're trying to do research, time is of essence to get through. And I think so. We need to look at, when we're in the educational institution doing the research, it's going to take time, and it's got to be built in as part of your research. It might not happen within that first year. The first year is all about engaging and collaborating. And so maybe the next year is when you need. So I think the funding needs to go from not just from 1 year initiative to a multi-year type of platform. I think that's part of our knowledge translation that we need to share with our academia and the funding people. So I think it's going to take more. If you're going to work with Indigenous people in the state, or anybody that's being affected by the research that you're doing. So, some quick points.
Thanks. No, that's a lot. The first point that really resonated with me was about addiction. So actually, the reason that I started becoming interested in this tax was because it's compared to tobacco.
Yes.
And interestingly, we view tobacco as an addiction, but we don't treat it that way in public health. And that's partially because of history and who got a hold of it first. Because any other addiction and how we treat it in public health came from psychiatry, but tobacco didn't. And so we decided to tax it. We would never tax any other addictive substance. So it's to me, there's a great misalignment there in terms of how we've decided to address it. Either it's an addictive substance or it's a vice worthy of taxation. And we also stigmatize it. So
also with that though too, when you're talking about the corn syrup and sugar cane, you really look at why that policy was created. Why is Canada and the US, we're one of the biggest agricultural producers in the world. So what a better way to promote your corn is an agricultural industry. It is you stop it from coming together sugars.
Yes, yeah.
So we need to address that. Like the agricultural side now is cutting into our traditional land, sustaining ourselves, such as the food, the wood, and then now you cut down the wood and you expand your agricultural things, which is also impacting the climate change that is happening, because now we're producing more agricultural machines and more pollution in the need for that corn, which also disrupts the nutrients of the soil, which does not grow traditionally back any of the foods that are needed, such as what we used to harvest at one time. So I think that we got to look at how we can influence the policy in the direction of really what is being impacted by the taxation of it. Where is that taxation going to go or change really? but it's not gonna impact us as Indigenous people who've been here for a millennium, based on who's actually profiteering from it. We're not getting any cutback on that, or utilizing our lands to create sugars.
Like, no, I totally agree with you. I'm trying to put down a lot of points. I wrote down the part about traditional speakers because I think that's an excellent point. And yeah, being trustworthy and agriculture. Yeah, that's been a part of that shaped the proposal quite a bit. It's also won me a lot of friends in agriculture, talking about all the white farmers on growing corn on stolen land. Anyway, yeah, no, it's much more complicated than I think raising the price of food.
Right. And well, if you look at it, corn was from the Indigenous perspective, which was called maize, helped for a lot of the growth on the first immigrants. North America, like Turtle Island, was the health of maize and beans and squash.
Yeah. Yeah.
We had a question from the online folks. It was around how you originally approached Indigenous groups about the project. Did you have connections connect you? And how did those early interactions go?
All my early interactions were very positive. I only really had positive experiences with all my Indigenous partners. So I think I mentioned I was already working with Jeff LaPlante from NADA on a different project. So he knew me, we knew each other, and so we had this conversation just like I would with a friend. I said I have these concerns about the sugar-sweetened beverage tax, and I said, "What do you think about it? Like, And then it was just a conversation, really. And then with Four Arrows, Jeff referred me there, so there was that. And then with AO, I had already met Michael from a different meeting. And honestly, on his part, it was probably a lot more trust because I didn't really know him. He didn't know me personally for getting involved. So, I mean, I'm really grateful to be working with him. But we've gotten to know each other now over, I think, a number of meetings before. I haven't started data collection in the North, so this is, we've met a whole ton of times now before we're even doing that. And and he's commented like, "Oh, I'm surprised you stayed, or you did another one." Like after the first bell tower, he's like, "Oh, we're doing another one." I've gone to the bell tower numerous times with my kids, so it's I try to communicate through my actions that this is not just like me using you for a research project. You can only communicate that through your actions. So I try to do that, and I'm not bringing my kids here for that. I think it's beneficial for them. But it's part of demonstrating, I think, your commitment and that you realize that these are very serious issues. I realize these are very serious issues, and I think health inequalities and discrimination and that. So I think that's how you build trust. You have to continually be there. You have to continually show that it's not just about the research project. Because I think it's really important. It's important beyond the research project. And I've learned a lot. It's great academically, as well as personally. I hope that answers the person's question. Thanks for the question. But yes, it helps if you have previous relationships. If you're not really if you don't have a history, it's hard. But I've been working in Indigenous health now as a researcher since 2009. So that helps, sure. Another question? Yeah.
How do you see this research going to be going forward from just a paper, and then you see it might be able to influence change at the political level, or is that just a hope, because hope does create movement?
I hope it does. I mean, I have talked to people from Health Canada, and part of this engagement was with Heart and Stroke Foundation on potential lobbyists. I think. I mean, I don't really know exactly what's going to happen. I hope, people listen. I think and I don't want to toot my own horn too much, but I think a lot of people's minds have been changed already on the policy. I've published on it already in the Canadian Medical Association Journal, so I know that there was a lot of pushback, but also a lot of people who I'm pretty sure have changed their minds based on it. Definitely cooled off, I guess, in the news. But part of that is also, I think, for political reasons. What will happen? I don't know. I hope to communicate the findings further through the media. I found that to be very helpful. I know that politicians read it. So the first op-ed I know was received by the NDP Health Critic. And I don't control what they do with it.
Have you considered getting into the Indigenous media also, their newspapers, op-eds, and onto their TV stations, and also onto their radio stations, and res radio, we call it, just to tell them this is the impacts of what we've been doing. I think because then you're getting more to the grassroots, and you can help influence.
Writing them down. And definitely I would work with communities, so with Island Lake. I'm pretty sure
I see the name, I know Larry. So.
Yeah, so in the past anyway, I try to work with whatever community partners, I guess. Like I know Aboriginal Youth Opportunities regularly goes on the radio, so that can be something that we do.
But they're mostly on, unfortunately, only on UW radio.
Right, yeah.
They don't get onto NCI. Don't get into the res radio. It's more of a
Local.
University, I'll call it propaganda type of thing.
Yes, no, those are very good points. I think media is very powerful.
Because it is impacting us as Indigenous people. And we have the highest diabetes growth in Canada. And it's unfortunate, but we also been created by governments to become sedimentary where we were never. That impacts for sure.
Well, we're just at about the 1 o'clock mark, so thank you again, Dr. Riediger, for sharing with us, and thanks to everyone for being involved.